And I'm a pediatric nurse practitioner at Westwood and Mansfield Pediatrics in Westwood, Massachusetts. And today I'm going to talk about newborn care. For those of you who may not be a member of our practice, I defer to your own provider for some of this information. There are more opinions out there than there are people, and everyone feels free to offer them to you whether you want them or not. As new parents, you're going to take what you can use and you're going to forget about the rest. Basically, there are 4 absolutes to taking care of your newborn. You need to feed them, change them, love them, keep them warm enough, and they'll be fine. The rest of this is the art of parenting, the art of feeding, and everybody develops their own art. So every new parent is worried about feeding. Babies need to eat somewhere between 8 and 12 times in a 24-hour period. And you know they're getting enough if they're peeing and pooping. So what you might want to do is just keep a little log with something as simple as check marks to say they ate at this time, they peed, they pooped, and you can bring it to your pediatrician visit so that you can review how your baby is doing. Every baby, it's recommended by the American Academy of Pediatrics that every baby sleep on their back to sleep, because we believe that that decreases the incidence of SIDS or sudden infant death. That doesn't mean you need to duct tape your baby to their back. When you put them into the crib or the bassinet, you just want to lie them on their back and they will actually find a comfortable position, which may involve turning a little bit to their side. When you're awake and with them, however, they should have some supervised tummy time, sideline time, so that they have the opportunity to develop the muscles in their chest, which they'll need for rolling over in the future, and so that they don't get a flat bald spot on the back of their head. Babies, the bones in babies' heads are very soft, and they'll mold according to the position. So we don't want them to be on their back 24 hours a day. The other important thing is skin-to-skin contact. There's a lot of research out there about the benefits of skin-to-skin, where you lie your baby's chest against your chest, something both mom and dad can do, and it helps with their neurological development. Because babies don't see themselves as a separate person from the moment that they're born. If you remember, for 9 months while you were pregnant, every time you walked, they got rocked, they heard your heart rate. So they didn't expect to go from this nice, safe place to over there in a corner in a bassinet. They still need to separate slowly, and the skin-to-skin really helps them with that. Hiccuping, sneezing, yawning, rolling their eyes in the back of their head, crossing their eyes, the startle reflex are all normal newborn things designed to frighten parents, and they do a good job, but they are normal. So what are the things that we worry about? We worry about babies who won't eat for more than 6 hours, because most babies will eat somewhere between every 2 to 4 hours. We worry about babies who wouldn't wake easily in a 6-hour period. It might be possible that they have 1 6-hour period of sleep, but when you go to wake them, they should wake easily. If they don't, that's another reason to call your pediatrician. Or if they develop any kind of temperature, 100 or more. So in the warm weather, sometimes it's the environment, they're overdressed. So if for some reason you decide you need to take the baby's temperature, you find that it's 100 or more, you want to undress them in about 15 minutes or so, take their temperature again, and if you find that it's still over 100, that's definitely a reason to call your pediatrician. If it's come down to a normal temperature, then it was more likely environmental. Please do not give any Tylenol products in the first 3 months without consulting your pediatrician first. Temperature is one of the most sensitive ways of telling if your baby is sick or not, and we don't want to mask any signs of illness. Anyone who's going to handle your baby should wash their hands first. Common sense, if they're sneezing, coughing, acting sick, I would ask them to postpone their visit. We also recommend that you avoid going to very crowded places like the mall or the food store when they're the most busy, because everyone loves a baby, everyone wants to touch the baby, but we want to protect them in this early period from any kinds of infections. that doesn't mean that you're a prisoner in your home. If the weather is nice and you feel up to it, you can go for a walk, you can visit friends, friends can visit you. We just ask that if anyone has had any signs of illness, they postpone their visit. In the state of Massachusetts, car seats are required by law. Every baby needs to be in a car seat. A rear-facing car seat for babies less than a year old and less than 20 pounds, and the middle of the back seat is usually the safest place. Ask your provider for a list of technicians in your area that can help make sure that your car seat is placed correctly in your car. Congratulations on the birth of your baby, and welcome to parenthood.